Good morning from the Oklahoma Insurance Department. My name is Rachel Fan, and I work in the Communications Division here at OID. Thank you for joining us for our Medicare Monday webinar series. For your awareness, I do want to mention that this webinar is being recorded. Before we get started, I wanted to share a little bit about what the Oklahoma Insurance Department, or OID, does. OID is a state agency, and we are responsible for regulating the insurance market and enforcing the insurance-related laws of the state. We have an entire team devoted to protecting consumers by providing them with accurate information and timely assistance. We can also deal with your insurance company if you cannot reach an agreement regarding a claim. If you would like to reach out to us for help, or if you have any questions, you can call us toll-free at 1-800-522-0071, and you can also visit our website at oid.ok.gov. For today's webinar, you will be able to see and hear us. However, we cannot see or hear you. If you have a question, please type it in the chat at the bottom of your screen. You will see several options, one of those being chat, and if you click on that, you can type your question there. We will save time to answer questions at the end of the webinar. Now I'd like to introduce our speaker, Ray Walker. Ray is the Divisional Director for the Medicare Assistance Program at the Oklahoma Insurance Department. Mr. Walker has over 20 years of experience working in and around the healthcare industry, primarily in insurance, and has had the privilege of speaking to groups across the state. Ray, over to you.
Thanks, Rachel. All right, well, we're going to go ahead and get started. We've got a lot of slides to cover. This is our first Medicare Monday for this year, so kind of glad everybody is here with us. I believe I'm already sharing my screen, so we can just move forward from here. Wanted to remind everybody that the Medicare Assistance Program is actually a grant-funded program located in the Oklahoma Insurance Department. We receive funding from the Administration for Community Living. The grants that fund our program are the SHIP grant, or the State Health Insurance Assistance Program grant, and the SMP grant, which stands for the Senior Medicare Patrol. We also have a grant for MIPA, the Medicare Improvements for Patients and Providers Act. And with these funds, we do what we can to provide outreach to Medicare beneficiaries in the state of Oklahoma. We also work with their family members and caregivers. And we try to address any issues they're having related to Medicare, answering questions about Medicare and how Medicare works and things like that. So we're very grateful for these grants and the funding that they provide us to do this outreach. We do quite a bit of our outreach through partner agencies around the state as well. And there's a slide about that a little bit later. So today's topic is Medicare Supplement Insurance. We decided to place this one at the beginning of our Medicare Monday series because of some recent changes that have taken place. So let's go ahead and get started. I want to make sure that we've got plenty of time to go through the slides as well as address any questions at the end. So before we can talk about what a Medicare supplement does, let's talk briefly about basic Medicare, because it's important to understand how supplement insurance works. So as you know, we've got Medicare Part A and Medicare Part B. Part A, most people get for free. They've been paying FICA taxes into the system. There is a way they can pay for Part A if they haven't worked long enough, but most people are getting it for free. And then the Part A is going to cover things like inpatient care. For inpatient care, there is a deductible that's associated with that. And then also Part A covers things like skilled nursing facility care, hospice care, and home health care. Then we've got our Part B of Medicare. Now, Part B has a monthly premium that everyone pays for. That monthly premium for 2024 is $174.70. People in higher income brackets actually pay more for Part B, but that's a topic for another day. Then also for Part B, there is a deductible, and it's an annual deductible of $240 for 2024, after which a person pays approximately 20% of their Medicare costs. So that kind of covers the basics. That's Part A and Part B. That's the Medicare that we all know that's been around since 1965. Now, what's covered by Part B? Those outpatient services, doctor's visits, x-rays, emergency room, medical equipment, things like CPAP machines and wheelchairs, as well as preventive services. So those things have that 20% cost that is not paid by Medicare. So if you think about it, you've got, deductibles with your Part A, you've got deductibles with your Part B, as well as the percentage that's left over after Medicare is paid. So those numbers can actually get fairly high. So what does a person do if they want to make sure that they've got coverage for those extra costs so they're not paying unknown amounts, or they're not responsible for unknown amounts in the case of an emergency or a catastrophic illness? So that's where Medicare supplement insurance comes in. It's also called Medigap coverage. And the reason why is because first Medicare pays as primary, and then Medicare supplement insurance comes in to fill the gaps that are left over after Medicare is paid. Now, currently there are 10 standardized plans that are available out there. Now, not all 10 plans are available to everybody, and we'll talk a little bit more about that later, but there are still 10 standardized plans out there. And each one of those plans is a little different, as you'll see on a chart that we've got on a later slide. Now, the benefits for each one of these standardized plans are standardized. The benefits, if you get a plan A or a plan B or a plan C, your benefits are going to be the same regardless of the company that you purchase it from. However, the prices for those plans can vary significantly. So we want to make sure that you understand what it is that you're purchasing as a consumer, because you may pay more for a policy, but you're not actually getting additional benefits. So we want to make sure that everyone is on the same page with that. Now, a Medigap plan can be used anywhere that Medicare is accepted. One of the other options that's available to Medicare beneficiaries are Medicare Advantage plans. That's the HMOs and the PPOs that are out there that are a great option. However, they do have service areas. So you are required to follow certain rules when you enroll in those Advantage plans, such as staying within their service area. Medicare supplement plans have a little more flexibility in that as long as the provider accepts Medicare, they're going to accept your Medicare supplement policy as well. Now, on the other side, Medicare supplement plans do not offer prescription medication coverage. You would have to have a Part D drug plan to cover your prescription meds that would go along with your supplement policy. Now, the first opportunity that a person has to purchase a Medigap policy is when they first start on Medicare. Now, you have to have Part A and Part B to get a Medicare supplement policy. And the Medicare supplement open enrollment period begins the day that you become effective on your Medicare Part B. All right. Some people delay starting their Part B because they're still working or something. And so they don't want to take out that Part B yet, and they can save that monthly premium. So consequently, they may delay starting their Part B. And then once they start the Part B, starts that 6-month period during which they can purchase any Medicare supplement policy that's available. They can't be charged more, or they can't be denied because of any current or pre-existing health conditions. So this is really a great time for a person to get a really good deal on a Medicare supplement policy. So outside of that 6-month period, a person might find themselves subject to underwriting. When we talk about underwriting, we're saying that they could request medical records, and they can take a look and see if you've had some condition like cancer or a heart condition, diabetes, or anything like that. And then based on that information, they might make a decision as to whether or not they're willing to offer you a Medicare supplement policy. So here's that chart that I mentioned a moment ago that talks about the standardized plans that are available and the benefits that those plans might be able to cover. In the first column on the left, you see the benefits that are eligible to be covered by the Medicare supplement policies. And then the letters that are across the top represent those standardized plans. Now, as you can see, there are only 8 plans listed here. More on that in just a moment. But if you're a new person that's just coming on to Medicare, these are the 8 plans that would be available to you to purchase. So for example, let's look at Plan A on the benefits. So there it says that Plan A, you could get your Medicare Part A coinsurance and hospital coverage up to the additional 365 days. So that's that coinsurance that you have to pay starting on day 61 for each benefit period. For Plan A, also, you can get your Part B coinsurance or copayment. So that's that 20% that's left over after you've met the deductible for the year. and Medicare is going to pay approximately 80%, this plan would also cover that 20% that's left there. On traditional Medicare, the beneficiary is responsible for the first 3 pints of blood. Well, if a person purchased a Medicare Supplement Plan A, that Plan A would cover those first 3 pints of blood. So that's an example of Plan A. Now, if you go over and you look at Plan B, it covers exactly what Plan A covers with the addition of the Medicare Part A deductible. So with Part A, there is a deductible for inpatient care that would be covered for anyone that has to be admitted to the hospital for that year. So that's a great benefit to have as well. So you can actually go through here and you can see anywhere that there's information or a check mark, that's where you're going to find that these plans actually provide coverage for those particular plans. Plans K and L, as you will notice, they've got a 50% or a 75%. That means that those plans are actually going to cover, let's say for Plan K, it'll cover 50% of the cost for the Medicare Part B coinsurance, or 50% of the skilled nursing facility care copayment, up to a maximum amount for that year of, for Plan K, $7,060. Once the beneficiary reaches that amount, then those services would be covered at 100% for the remainder of the calendar year. So this chart it's very easy to read, it's easy to use, and it's a great way for a person to gauge what are those benefits that are really important to you to know that are covered. Now, I want to mention very quickly Medicare supplements for individuals who are on Medicare due to disability. In case you're not aware of this, a person has to be on disability, Social Security disability, for 24 months before they qualify to receive Medicare. They, in that 24-month, that's when their 6-month open enrollment period would begin. So the laws regarding Medicare supplements and disability do vary significantly from state to state. Some states don't offer Medicare supplement policies to individuals on Medicare due to disability. Now in Oklahoma, we do. Our regulations say that any carrier that offers a Medicare supplement plan in the state of Oklahoma must offer at least one standardized option to individuals who are on disability during their open enrollment period, that first 6-month period following they start the beginning of their Part B. Also, those individuals cannot be charged more than the lowest aged rate for that Medicare supplement policy. So they're not going to be gouged for being on Medicare due to disability. They're going to get charged that lowest aged rate. Now let's talk about some changes regarding Medigap policies for 2024. Actually, some of these started earlier than that. This one started in 2020. I mentioned earlier that there were 10 standardized plans that were available currently. But as you looked at that chart, you only saw 8. Well, that's because anybody who became eligible for Medicare after the year 2020 is no longer capable, no longer eligible to purchase a Plan C or a Plan F. That's because those two plans, C and F, covered the Part B deductible. And beginning in 2020, a law was passed that said that the Medicare supplement plans could not be sold to individuals who were eligible for Medicare after 2020 that covered the Part B deductible. They wanted to make sure that all beneficiaries had some expense. And I think that the idea behind it was we had a lot of people that were covered by Plan F. Plan F was the most popular plan, and it provided what was called first dollar coverage. That meant that for whatever service you needed, whether that was in the hospital, outpatient, etc., if Medicare didn't pay for it, your Plan F did. And therefore, people were more likely to just go to the doctor for a lot of things that medically they might not necessarily have needed to go to a doctor for. So by making them meet the Part B deductible to begin with, which is $240, like we mentioned before, then they're less likely to just, immediately go to the doctor. So now the next most comprehensive plans are going to be Plan D and Plan G. And those are rapidly gaining on the Plan F population in terms of how many people are purchasing those policies. Plan G covers everything that Plan F covered with the exception of the Part B deductible. So those are as I said, they're becoming much, much more popular and they're gaining on Plan F. Now, what we're seeing is that because there's no new people getting into Plan C and Plan F, the premiums for those plans are going to start growing more rapidly in the future as fewer and fewer people are on Plan F, and the people that are on that plan currently are getting older and probably experiencing more health conditions. So that's why this new Medicare supplement rule was put into place. It became effective September 1st of 2023. And what it says is that anyone who currently has a Medicare supplement policy will have an opportunity to shop for and purchase a different Medigap policy that has the same or lesser benefits each year for a 60-day period that starts on their birth date. So if your birth date every year is February 5th, then every year on February 5th, you would have a 60-day period during which you could shop for and purchase a plan of the same level that you're currently in or something less within that 60-day period, and they can't force you to go through underwriting. All right, it would be just like your initial open enrollment period where it doesn't matter if you've had any current or past health conditions, you could get that policy. Also, your current carrier, whoever you're currently with, must provide proof that you have that current coverage for the new carrier that you're switching to. Another part of that same rule change says that for individuals who are on Medicare due to disability and who have a Medicare supplement policy, their current plan must notify them within 6 months of their 65th birthday that they will have another 6-month open enrollment period during which they can purchase any Medicare supplement plan with guaranteed issue rights. You'll recall that when I was talking about people who are on Medicare due to disability, every carrier has to offer at least one of the standardized plans, but they don't have to offer all of them. When a person on Medicare due to disability turns 65, they get a new open enrollment period during which they can purchase any plan that's out there and have those guarantee issue rights. And this rule change simply guarantees that those people are notified and they understand that they have that right. So why did they do this? Well, this new rule prevents people from being trapped because of their health issues. There's a number of people that when they first got onto a Medicare supplement policy were probably in very good health, but over the course of time, maybe things have changed as they've gotten older and they've developed some health conditions that would make it very challenging for them to get a different Medicare supplement policy. And so they are more or less trapped because they can't get a different policy and their premiums are getting higher and higher and higher. So this is going to prevent those people from getting trapped into those policies and not being able to switch. It's also important to understand that people who initially purchase their policy in another state, they can take advantage of this new rule as well. So we've got some people that may have moved here over the course while they've been on Medicare. That doesn't make a difference. Those people can change as well. The new rule does not impact rules related to Medicare Advantage plans. This does not apply to people who are on Medicare Advantage plans. The other thing to keep in mind, and this is important, the beneficiary cannot have gone more than 90 days without their Medicare supplement coverage. So if someone, quit their Medicare supplement policy 6 months ago, unfortunately, they're not going to be able to take advantage of this. That doesn't mean they still couldn't try to purchase a Medicare supplement policy. However, they would be subject to underwriting. Now, if you're curious about what would be considered a plan of equal or lesser benefits, here's a chart that indicates what those plans would be. So clearly a plan A goes to a plan A plan B would be a plan A or a plan B, et cetera, as you can read down this chart. So someone who is currently enrolled in a plan F, that's the one that we told you had first dollar coverage, a person could get another plan F, which I don't know that they would, that would defeat the purpose, but they could get pretty much any plan that's out there. Plan G allows a person to get anything from a Plan G and down. So this chart kind of helps people understand what their options might be in this situation. If you'd like to see what those birthday, and we kind of call it the birthday rule. If you'd like to see a whole list of frequently asked questions that were developed, those are available at this website. So feel free to write this down, or you can just Google you can go and search it off of our website as well. And
Ray,
it'll
I'll
take
put
you.
it in the chat as well for everybody.
Oh, thank you, Rachel. Thank God for Rachel. She's going to put that in the chat. You guys can just click the link and it'll take you to the full list of the frequently asked questions. And then, of course, you always have the option of calling us if you have some additional questions. Now, we're going to talk about something that's a little bit different than the open enrollment periods. This is some Medigap protections that have been around for a number of years that are just called the guaranteed issue rules. These are other opportunities when a person has the option of getting on or changing a Medicare supplement policy where they've got some protections. For example, if a person is enrolled in an employee welfare benefit plan, let's say that you are retired from a company that offered a retirement health benefit, and the company decides they're not going to offer that plan anymore. And so they've terminated that coverage. It's not you volunteering to leave. They've terminated the coverage. You would have a 63-day period during which you could purchase a plan A, B, D, G, K, or L. The next one would be a situation where a person's on a Medicare Advantage plan, and that Medicare Advantage plan moves out of the service area. They're not going to be in that state or in that part of the state any longer. Those people would have a guarantee issue period where they could purchase a plan A, B, D, G, K, or L. And then you can read down through there and see those other options as well. All of this information, by the way, and I'll show you the booklet here in a second, we've got a Medicare Supplement Buyer's Guide that we can provide to you free from the Medicare Assistance Program at the Oklahoma Insurance Department. And you can see it electronically on our website as well. So these are just some options when a person can purchase a Medicare supplement policy and have those guarantee issue rights. So what do you do? Now we've talked about what they are, and I know this is very, very brief, but so if a person is interested in getting a Medicare supplement policy, what's the process? Well, you need to find out what are the benefits that are important to you to know that they are covered. And then you can contact us and request a quote. We have a tool that is provided to us through CSG Actuarial, where we can go in, you give us your age, your gender, whether or not you use tobacco products, and your zip code, and tell us which of the standardized plans you're interested in receiving a quote about, and we can run that comparison for you and send it to you for your comparison. And we're happy to go through it and kind of explain the information that's on there. Now, when it becomes time for you to purchase that policy, you will need to go through a licensed insurance agent here in the state. And we've got a lot of great agents that you can contact. We can even give you a list of phone numbers to contact the companies to find out who the appointed agents are in your area. And then you can purchase your policy. This is the cover of the Medicare Supplement Buying Guide. And then there's a tool that goes along with that buying guide that's the supplement, the addendum. And that's got more of the details that change on an annual basis. That's because we print these booklets out in bulk, and we were having to pitch quite a few of them at the end of the year, and that's just wasteful. It drives me crazy. So many years ago, probably a long time ago, we quit doing that. Now we print the main booklets that's got the things that don't change, and then anything that's different or updated gets printed in the addendum. So both of those are available on our website at map.oid.ok.gov. You can request paper copies and we'd be happy to send those to you, or you can just look at the electronic copy on the website. Okay, so if you're looking for resources around the state from places that might be closer to where you live, these are the agencies with whom we contract to provide services locally. So as you can see, here's the name of the agency, the counties that they are responsible for, and the phone number that you can reach out to talk to somebody there, or if you want to make an appointment to go in and see somebody. So this information is also contained on our website. Before we get to Q&A, I wanted to make you aware, we've got our upcoming schedule for the Medicare Mondays. So in March, we're going to talk about the low income programs that are out there. There's going to be some changes that took place last year that are going to impact what people are eligible for and when. So we're going to cover those in March. April, we're going to talk about the Medicare Part D coverage phases. There's also some changes that happened with the legislation last year that are going to help people out with their prescription drug coverage. So we want to cover those early in the year as well. May is Mental Health Awareness Month. And so we're going to talk about Medicare and how it covers mental health and addiction treatment. June is when Senior Medicare Fraud Awareness Week takes place. So we're going to cover Medicare fraud prevention and what's latest on that. And July, we're going to talk about Medicare appeals. A lot of people do not understand they've got 5 levels of appeals when they are dealing with a Medicare denial. We want to make sure people know what their rights are and how to access those rights and what supports are available to them. August, we're going to talk about Medicare marketing guidelines because we're getting ready for open enrollment. And then in September, all open enrollment notices. What are the things you should be looking for in the mail to understand what your current coverage is and what your options are for the future? October, getting ready for open enrollment. October 15th rolls around much more quickly than we think it does. Then in November, we're going to switch gears and talk about preparing for future healthcare needs. So what are the changes that people need to be aware of and just preparing for those. And then in December, we'll hopefully have the information so we can talk about what changes we know are going to take place for 2025. So now, Rachel, I don't even know where we are in time. I know we don't have much time. Do we have any questions?
We do have a question, and we've got a couple minutes here to talk about it. So our first question is, if enrolled in a supplement Med-Gap policy that is no longer offered for sale to new participants, but still covers existing policy owners, would a person who didn't like the 60-day trial on a new policy have the right to come back to that original policy?
Can I get you to read that for me again?
Absolutely. So this is regarding the 60-day annual birthday rule. So if enrolled in a supplement or Med-Gap policy that is no longer offered for sale to new participants, but still covers existing policy owners, would a person who didn't like the 60-day trial on a new policy have the right to come back to the original policy? And if that one's a little more in depth, we can also have that person reach out via email to get more information.
My understanding, I don't know that we've had this question before, but since it's of equal or lesser value, then I'm going to assume, but I think that what I'd like to do is take that question back and let's get a definitive answer. I think it's a really great question because that is one of the rights. People have a trial right period to test drive a Medicare supplement policy. And I think we do need to look into that and see how this is going to impact that. Great question.
Perfect. And then we also have a question, and I'm not sure that this is one we'll be able to answer or not, but it says, does any company offer anything other than Plan A for those under age 65?
There are actually. There are like one company, or is it two? There's one company that offers a Plan B, and there's a couple of them that offer a G high deductible. So there are some, we just have to, run the quote.
Perfect. And I am putting our email address in the chat. So if we have any additional questions that we didn't get to today, please feel free to email us at map@oid.ok.gov or give us a call, and I'll put our phone number in the chat as well. And then Ray, did you have anything else you wanted to mention?
I think that's it. I appreciate everybody joining us today. And I hope this was helpful. Please go out to the website and learn some more and call us if you've got any questions. Thanks.
Thanks, guys. Bye-bye.